welcome to tonight's webinar. Tonight's webinar is called Head First, and it's all about concussion, your guide to assessment and recovery. I'm Dr. Adam Smith. I'm a chiropractor based on the Gold Coast in Queensland, in Australia. So if you're watching this and you're not from the Gold Coast in Queensland, hi, it's good to have you here. If you are from this region, then it's good to see you today. Now, acknowledging those people that came before us who cared for our lands and where we now live, it is important, and it shouldn't be controversial. While I do not have any First Nations heritage myself, members of my family do. This practice here in Southport, where I get to work and contribute to my community, is in the Yungambeh region. So as a small token of mine and my family's appreciation for the land and its people, we acknowledge and pay respect to the Yungambeh people, the original custodians of these lands and waters. We also acknowledge the many other Aboriginal people from other regions, Torres Strait and South Sea Islander people, who now live in this local area and have made important contributions for this community. I truly value being here on the Gold Coast. This is an amazing place to live, and I thank those people that came before us for looking after this land so wonderfully. Now, who am I? Well, I'm a chiropractor. I'm a father, I'm a husband. I've been a chiropractor for more than 20 years now. I've worked internationally. I've worked with multiple sporting teams, including the V8 Supercar Series in Australia, NRL teams. I've worked with rugby union teams. There's all different areas of the world that I've worked in, and in different sports and in different focus areas. I have a special interest in what's called neurorehabilitation, which is where this concussion webinar comes in. This is an area that is really a passion of mine. And the brain excellence practitioner bit, well, we're going to learn a little bit more about that in a moment together. Now, today, over the next 30 minutes or just less, we're going to cover the facts and at least some of the fiction surrounding concussion. There's a lot of misinformation out there on this topic, and it's often over-sensationalized, or even worse, underreported and downplayed. Most people think of professional sports like Australian rules, rugby union, the NRL, when concussion is mentioned. In fact, if you've watched even one game of any of these codes live or on TV, you've probably witnessed a concussion happen right in front of your own eyes. We're going to cover how you know you have a concussion, what effects a concussion can have on your life, both short-term and long-term, and we're going to know when to act, when to rest, and crucially, what you should and should not do if you've been concussed. If you're watching this on the recording later on and not live with me right now, hi to those people online, by the way, please send the link to this webinar or to a friend or family member who you think could benefit from the information. You're going to learn as we go along who those people in your life might be. And I encourage you, when we get to a part of the presentation that reminds you of somebody else's experience, and you think, I really should send that to this person, make a note for yourself to send this link when you can to them so that they can benefit as well. Okay, so how are we going to go tonight? Well, tonight I'm going to bribe you. Not like that, not with money. What I'm going to do is I'm going to bribe you with knowledge and understanding that you may not have had before today. Then at the end of this webinar, I'm going to make an offer. That's it, just an offer. I'll let you know how you can use our services if you wish. And while I truly love helping people just like you with their recovery from conditions like concussion, you have a choice. You can choose to continue on with your life as it is right now, making no changes. And no, you don't have to come into my office if you don't want to. You can, of course, make a different choice. But for now, let's get into this topic and learn more. So I want you to meet Jennifer. Jennifer is our guide to the real world of the effects of concussion. You may note that Jennifer is not a football player or a boxer or even a racing car driver. You don't have to be a professional athlete to experience one or more concussions. Jennifer has had multiple concussions in her life, and she's probably not the obvious option that you would think of when you think concussion. It's important to remember that Jennifer's experience is specific to her, and while there are common elements to this and other people's stories, everyone experiences concussion differently, and the results of assessment and treatment vary greatly. You should always seek the assessment and advice provided by a suitably trained health professional when you make decisions about your health and the health of your family. You can think of that as a generalized disclaimer. Always ask if you're unsure and if you're uncertain. We will often see people write in the media about concussion as a small thing or no big deal, or they were concussed. And these sorts of things tend to be trivialized. And while it is true that most symptoms of a concussion do heal naturally over time, this is not everybody's experience. Do you think if you increase or decrease your chance of lasting symptoms by getting multiple concussions? If you said increase, then you'd be right. You'd be right in thinking multiple concussions increase the chance of long-lasting issues, but it is also crucial to know that even just one concussion has been shown to cause chronic health problems in some people. And that's the real-world effect of concussion. A concussion is what's known as a traumatic brain injury, or TBI. We're going to talk about that a lot tonight, and there is no defined clear definition of concussion. People disagree. And while concussion is widely observed as a functional issue, we're aware that it's not always a structural one as well. And we're going to get to the difference there in a moment. So your brain is at the core of what makes you who you are. When it works right, you work right. And when it is troubled for whatever reason, you are much more likely to have trouble in your life as well. Many people think the brain is this rubbery sort of mass fixed in the skull. It doesn't move around, but that's not the case. Your brain is soft and squidgy. It's about the consistency of butter or tofu or a thick custard, and somewhere around about between egg whites and gelatin. It's rubbery, is what I'm getting at. And it floats in a bath of cerebrospinal fluid, and it's supported by ligaments and these cords that hold it in place. Think suspension bridge, but it floats in a very hard skull, which is designed to protect it. But the inside of that skull has a lot of sharp edges and ridges, and due to these ridges, your brain can be easily damaged when there's excess movement inside the skull. So think, whiplash, jarring, shaken baby syndrome, even blast injuries or blows to the head. This can cause your brain to move around uncontrollably, and it can really slam into those edges, and it can create problems. And those are the mechanisms of severe brain trauma. But think things like, bruising, broken blood vessels, and that can increase the pressure and change the oxygen supply to the brain. So this is not a good way to be. In addition to that, you can have something called the pituitary gland that can be affected. Now, your pituitary gland, as you can see on the picture here, it's right down the bottom of the brain. It's that bottom arrow that's pointing there at the back of the throat. And your pituitary gland is the master hormone regulator, and it sits in a fairly vulnerable part of the spine from a concussion perspective because it's often damaged by head injuries. And this can lead to wild hormonal imbalances. When you look at the zoomed in view, you can see that it hangs down in that bony cup. That bony cup is called the sella turcica. It means Turkish saddle. And so someone thought back in the day that it looked like a Turkish saddle. And your pituitary gland sits in there. Now, if your brain moves forward and back quickly, it can put a lot of pressure on the stalk that goes to the pituitary gland, and that can cause damage. And above all, we don't want damage to any structure in the brain. Because even a mild concussion does not mean it'll have a mild effect on your life. This quote is worth remembering. A mild concussion is not always mild. This is the conclusion of Brain Injury Association of America. This is not my opinion. They've produced some of the best quality research into concussion that currently exists, and current data suggests that in America alone, every 9 seconds, someone has sustained a brain injury. Now, brain injury affects how someone thinks, acts, and feels, and the symptoms and impacts are wide-ranging. They can change everything about someone in just a matter of seconds. A car accident, even a small one, can cause a TBI. And remember, no two brain injuries are the same. The effects of the injury can be complex, and they vary greatly from person to person. We'll come back to that in a moment. So what's a concussion? Well, there are 3 main types of concussion. A direct impact to the head by an object or a surface is the most common type. Acceleration, deceleration, like whiplash. This is the second most common type. And a shock wave emitted by an explosion or a blast, known as a concussive wave, whilst less common, this type of injury can go undiagnosed and can create long-term effects. So let's just look at this for a second, what it looks like when we don't have the helmets on, though. Bit different, right? This is more of the real world impacts of and how that mechanism works. Because people who receive a direct trauma to the head, they're not always driving around wearing a hard hat or walking the streets wearing a bicycle helmet. You rarely wear a helmet when you're driving your car on public roads, or at least I don't. In the military, it is common practice to wear a helmet. However, the helmets are designed to protect you from shrapnel, not a concussive force. I was having a discussion with one of my clients today about this very thing. He's ex-military, and he was saying that the helmets are even more or less useless depending on where they're made, so the manufacturing of them comes into play as well. Now, some of you may remember from 2024, earlier on this year, I don't remember what date it was, I'm sorry, but this is an example of two impact forces, not just one. Reece Walsh, who played fullback for the Queensland State of Origin team, he was tackled during State of Origin game number 1. And it was deemed by the officials that it was a dangerous tackle with direct impact by the shoulder to the head. Now, Reece was knocked out instantly in air, and he fell backwards to the ground where his head impacted the field and caused a second trauma. In the second picture that we see, you can see Reece's arm is outstretched like this. Okay, and this is something known as fencing response. Now, this likely happened from the first impact, but also the second impact of him hitting the ground did not help. And there was a few seconds there where both of Reece's arms were outstretched on the ground like this in fences response. This occurs when the impact has been severe enough to impact the brainstem, where a reflex that's usually only seen in babies called asymmetrical tonic neck reflex, or ANTR, was momentarily reactivated. Now, a 2009 study on this concluded that up to 2/3, up to 2 in 3 high-impact head traumas resulted in a fencing response, and that it only occurs in moderate TBI or severe TBI, not a mild TBI, so not a mild concussion. This fact alone should have resulted in Reece being ruled out for longer than the standard 3 weeks that he was ruled out for. Serious brain injuries are rare, but sometimes in a concussion, a serious and long-lasting injury can happen. In the years between 2010 and 2012, there was a notable increase in deaths from one-punch attacks, especially here in Queensland. Surfers Paradise was horrible for it for a while. And this is when someone gets struck on the back of the head or neck with no warning. Even if the victim does not die in the attack, serious injuries can happen. So in 2014, Queensland Parliament introduced a new law to combat this, and thankfully since then, this type of attack, called a coward's punch, has been reduced greatly in frequency. Not all serious injuries come from a punch or even a direct impact to the head. Serious and lasting injury can occasionally happen in all 3 types of concussion. And when this happens, the serious type, this is a medical emergency. A serious brain injury has 3 different types. You can see this is an intracerebral hematoma, an epidural hematoma, or a subdural hematoma. Now, the intracerebral hematoma is the one that's in the brain tissue, top right. An epidural hematoma is the one that's just underneath the surface of the dura, just inside the skull. This is the one on the right-hand side, just above the right-hand side of the screen, just above the left eye. And the subdural hematoma is the one that you can see on the left-hand side. This is below the dura, outside the brain, and it pushes down on the brain. So one you can see on the left side of the screen, just above that person's right ear. These become important in a little bit. So who's most at risk of concussion? Well, I'm sure you all now realize concussions do not just appear in sports, and there are 3 different types of force that can cause concussions, right? But who's most at risk? Well, it turns out, based on data collected by the World Health Organization and the University of Queensland, men are twice as likely to be diagnosed with concussion than women. Clearly, certain sports like boxing and MMA and footballs of various types have a higher likelihood of concussion. but certainly demographics such as military personnel and victims of domestic abuse are particularly high risk as well. In fact, domestic violence, often shortened to DV, is a major underreported cause of traumatic brain injury. And there's so many women mostly that suffer from domestic violence who go with unreported concussions for weeks, months, or even years. Do you think that this class of injuries in football makes up 10% of the overall injuries in football? I think this maybe requires a little bit of further investigation. Well, you bet it does, and they are. Concussions happen both training and in competition play in NRL, in rugby union, and AFL. And with recent news articles and court cases showing that link between identifying and managing on-field concussions and then the long-term health concerns of the players, this is becoming much more evident. This makes it very important that we continually develop our assessment and treatment options, but also implement programs and rules that try to limit the occurrence of concussions in the first place. Just think back to the pictures of Reece Walsh there laid out on the ground. If you saw that hit live, you would be very supportive of changing the rules to make it less likely for someone to have a concussion. The amount of concussions that occur each day is massive. University of Queensland Brain Institute says that while the mechanisms vary, almost all TBIs relate to a concussion. So up to 90% of injuries to the head can result in concussion. That's almost all. Now, I've played as a goalkeeper since I was 5 years old. I also rode surf boats competitively for many years, and I've had quite a few knocks to the head myself. I suspect that a recent hit to the head in the last few years that cracked a tooth in my jaw probably resulted in a concussion as well. So it's likely that I had a few concussions over the years myself. This is not uncommon. The World Health Organization says that about 42 million concussions happen every year around the world. And so that means that about 1 in every 200 people on the planet can be affected by a concussion. Now, some people will have more than one. But if you think about it like this, that's one person per grade in some schools. It's 2 or 3 people per surf club. It's even more per football club. My football club, that'd probably be 3, 4, 5, 6 people across the course of any given season that might have a concussion playing. So, like many head injuries, though, the problem is that 9 out of 10 concussions go unassessed by health professionals. And that relates to 37 million traumatic brain injuries left unchecked every year. So it's my job, and now your job too, to raise the profile of the damage concussions can cause and help more people in our community get assessed and get the help they need as quickly as possible. So the major causes of concussion, well, can be broken down pretty easily. Assault makes up 11%. Sports or being hit by an object makes up 19% when you put them together. Falls account for 28%, which is the largest category. And car accidents make up 20%. So when you think about it, sports is not the biggest category. Even getting hit by something in sports only makes up 19%. So that means 81% of concussions are not related to sport. Jennifer here had 3 car accidents in the last 18 years, and this just shows that concussions can affect everybody, and the effects can be cumulative. Each concussion can set the stage for more serious and long-lasting effects in the life of the sufferer. So please, if you're watching this live now, when you get the link, send it to a friend. If you're watching the recording and you already have the link, send it to someone who's going to benefit from this information, and so they can learn more about traumatic brain injury and concussion as well. The important thing on this slide that you'll notice as well is that Jennifer was recently divorced from an abusive relationship, and that meant that those concussions had gone unreported because of the mechanism. So how can concussion affect you? Well, the vast majority of TBIs have these types of symptoms associated with them. Symptoms can be temporary, lasting only minutes to hours. They can be present for longer periods, like days or weeks. And this is why as a health professional, I always find it of major importance to do a thorough assessment when I see someone for the first time, or if someone's symptoms have changed and they've had a head injury in between visits. So that, because there's so many people every year that present to me with like headaches or sleeping problems, and they think these things are just normal or minor. Okay? But upon further investigation, there's a lot more going on. A headache is not always just a headache. A headache could be a sign that there's something more happening. Moderate and severe TBI makes up only a small percentage, but they have more symptoms. So remember the slide with the brain bleeds from earlier on? Well, this is where those types of injuries are present. And these are the symptoms to look out for when you suspect someone hit their head or had a big car accident or been around an explosion. You want to catch these symptoms early and get them to emergency. That can literally save their life. Who remembers Michael Schumacher from back in the day? Michael Schumacher was the Formula One champ for a number of years, and he did get injured driving. He got injured skiing. He managed to avoid the concussions whilst racing, as far as we know, because race cars are designed to shield the drivers of impact. The drivers sit in this reinforced carbon fiber part of the car. It's called the bathtub. And this is the seat is bolted to that, and they're strapped to their seat, and they have their helmet strapped to the seat as well, so they can barely move. So in an accident, they are not injured like we would be when we're thrown around in our own car. But remember, the brain moves in the skull. So even with all the extra protection, the impact of car racing can still be devastating for people. And Michael's still dramatically affected by his accident, his skiing injury, and this is many, many years now. He certainly improved, but he hasn't been seen in public for a good long period of time, and this is what we see with post-concussive syndrome. Post-concussive syndrome can last months or years. It has all of these different effects that you can see on the screen here, and they can be long-lasting. People with PCS cannot maintain meaningful employment. They can't participate in social or sporting activities properly. It can have dramatic effects on them holding down even the most basic of tasks. I've seen people with PCS that even the most basic of employments, they can't do it because they're sensitive to bright lights. There's a lot of people talking. They can't work in customer service, and they get tired really, really easily. So these are the things that can last a long period of time and can build with multiple concussions over a period of time. So how do we test it? Well, diagnosing can be difficult, but it's critical to get the right information. So there's always a thorough history and assessment that goes on. This page shows you some of the forms that are part of what's called a SCAT-6. This is the sports group concussion assessment tool, and this is designed to clinically assess the severity of someone post-concussion. It acts more like a scoring tool and a series of physical and cognitive tests that are administered by the health professional that then record it. And if you end up with an appropriate score from things like running on a treadmill or remembering 5 random words for several minutes, man, woman, camera, person, TV, these sorts of things, then this goes down on the SCAT-6, and if you get a poor enough score, you're deemed to have a concussion. There's a version for kids as well, and this involves similar but child-focused assessments. And it's critical that these tools are used within the first 3 to 5 days max of a suspected concussion, because the detection decreases in reliability over the period of time with these tools. Now, we can't use MRI or CT scans or X-rays or ultrasounds to diagnose a concussion because the changes seen in each are dramatically different, and they're usually symptomatic functional changes, not structural changes. So while tools like fMRI, functional MRI, are being used in studying concussion, things like blood tests and regular scans and these sorts of things are of no use in determining whether someone has a concussion straight away. This is the new standard. This is the NeuroFlex. This is a technology that assesses the function of systems like the vestibular ocular motor system, and it's leading the way in diagnosis of concussion and determining what specific functional deficits are present. It utilizes VR headset technology, and it's guided using standardized testing protocols that test each individual uniquely against a set of standards. This will help health professionals make better guided clinical decisions based on objective functional measurements, not just forms and subjective questions. Unfortunately, sometimes when a health professional has a vested interest in getting a player back on the field or someone back to work, their judgment is not always objective and can be very subjective. So you remember Reece Walsh from earlier, the State of Origin player? If we had a baseline scan of him before he started his season, and then when he had his injury, he could be scanned again and then managed without any bias or guesswork. So this would protect the player. This would get them back on the field at the right time. And currently the protocol says 3 weeks for everybody, but that is 3 weeks not enough? Is it too much? Are there other things that need to do that you can get the player back on the field when they get back to their baseline sooner? Well, there is, and this is becoming the new standard of assessment. So it's important to know what doesn't help in concussion. So Jennifer found that like many sufferers of concussion, her senses were overwhelmed really easy, and compared to earlier on in her life. She didn't have a professional assessment as her head injuries happened. She just shrugged it off. It was part of her normal life. She didn't have any healthcare training herself and no access to someone in her family or friend circle that did. So she just never thought to mention it to her GP. Now, unfortunately, this lack of resources led Jennifer to suffer with some of the long-term associated symptoms that you normally only see with a severe trauma in post-concussive syndrome. She was sensitive to bright lights and loud noises. She had a tendency to focus on reliving the incident, and this created worry unnecessarily. And she was very easily overloaded with her senses. Now, what she found did help, almost by accident. She found some activities that she found beneficial, like focus and calm. That's what she was looking for. And so she found when she was out in nature, in her garden, smelling flowers, this was quite soothing. She then listened to podcasts, trying to find some answers to what was going on. And so she found that she could focus on her breath work and focus on breathing, and this would help too. When focusing on her breath, it helped to calm her mind. And so this was then something she could do when she was at work. So she started being able to get back into work. And remember, she worked in an office. So she also then, from the podcasts, tried cold plunge or ice baths. She found this to be really beneficial. The cold exposure seemed restorative to her body symptoms. And so then she moved on from that and with that added in head massage and cranial work. The head is super important, obviously, to be relaxed, and the skull bones should move, even just a little bit. Her head and neck should move properly, and this had a positive effect on her headaches, even if only for a short period. So the research says that cerebral blood flow decreases during the acute and subacute phases of concussion. So acute meaning straight away and subacute meaning in the first few days. And this study here looked at people who are 16 to 19 years old, and what they found was that there was an acute decrease in the blood flow in sports-related concussions in 16 to 19-year-olds in the blue areas that you can see on screen there. And that's important because those are areas that are sensory and functional, which makes sense because what also happens is the cerebrospinal fluid, remember, around the brain and in the spinal cord, that becomes more static. And that stasis is a problem because that can stop the brain performing at its best and your nervous system performing at its best. So the research says here that stasis can happen without trauma, but it does happen a lot with trauma. And mechanical cord tension, so in the neck, and something called vertebral subluxation can happen with that concussive trauma as well. Now, as a chiropractor, I know chiropractic care is aimed at improving that cerebrospinal fluid flow by getting the neck and head moving better, getting the spine moving better. And that's a functional change. This is research specifically about the NeuroFlex. Ekaterina Lonkova and her team at McGill University in California are researching the assessment of concussion using eye tracking software. And that's what the NeuroFlex is. It uses 12 different cameras, 6 per eye, and it tracks the eye and the head movements using gyroscopes against a standardized set of tests to determine whether someone is functionally affected from a concussion. And the research suggests that the involved brain areas that are susceptible to traumatic injury and that we can test using the eye tracking, using an oculomotor evaluation, are those same blue areas that we saw on the research a moment ago. Put simply, head movement and eye tracking against accepted standards is a really good way of assessing the visual oculomotor system, which we know is affected by all forms of TBI, even the mild ones. In order for your brain to function optimally, you need to be able to move your head, move your neck, and eyes in appropriate response to a stimulus and through voluntary control. Most medical personnel try and complete some of this testing with known trauma cases. If you've seen some of this being done on the sidelines by doctors, you will have seen stuff like, for example, hold my finger in your gaze and move your head, follow my finger, these sorts of things. But how does this work? Well, what we see is you have to be able to hear the stimulus first. right? So if you hear the stimulus, you've then got to be able to send that message up to your cortex. That cortex then sends a message back down to control the neck and related muscles. You see the stimulus, and this comes in from the eye, and look at the finger, and the eye sends the signal to the brain along the optic nerve, and then go to the other side of the brain, funnily enough, and then to the superior colliculus, up to the cortex, back down to the brain stem and the cerebellum, and then to the cranial nerves, and then to move the eyes. All of this relies upon your body's proprioceptive feedback, so knowing where your hands and feet and body are positioned in space, as well as your brain getting to know where your head is. And all of these body movements come with millions, maybe even billions of signals per second back to the brain. This is an important system to have right. So what can affect that? Well, we talked about this before, a subluxation. What is a subluxation? Well, stresses like a concussive force can cause a condition known as subluxation. In chiropractic, we use this to mean a part of the spine that is not doing its job properly. It's not functioning correctly. It's dysfunctional. The word subluxation is lux meaning light, in sub meaning less, and ation is the process of. So it's literally the process of less light. So most people, when they come into us, they talk about their pain, their muscle spasms, their restrictions, and they think that's all we care about, and we're just here to make them feel better. Now, I do care how you feel, but what I care most about is how your body heals, that functional capacity that your body has. So when we see people, we're not always going to be only focused on helping them feel good. We're helping them heal properly. So just think about it, if you go to the gym, if you're doing it right, you're not feeling great all the time. Sometimes you're feeling sore. And so this is how a corrective process can also happen, because the brain and the body are intrinsically linked. The nervous system is the master controller of all those systems in the body, because it's not just how you feel. About 90% of what we do is function of the muscles and the organs, and only about 10%, little 10%, is about sensory feedback from the body to the brain. So you can only really feel 10% of the whole nervous system, what the nervous system is doing. So the nervous system controls every function in the body, brain, spinal cord, and nerves all together. And a concussion affects more than just your brain. It can impact all parts of the body through a process called dysregulation. But you don't always know when you have that problem, because only 10% of the nerves in your nervous system are about feeling. The rest are about function. So what Jennifer did, Jenny got an assessment. She and I have met. Now, obviously, I can't talk about her case specifically. What I can say is that she now knows more about her nervous system and about chiropractic care, and especially about optimizing her health and healing after her many concussions. Now, rehab can be a very slow process sometimes, especially if you don't have the right help. Healing is different for everyone, and healing does take time. Does it make sense, though, to use the best resources available to get you back on track predictably and as quickly as possible? Well, that's why we have that offer that I mentioned before, that bribe that we talked about. That bribe can help you get your own analysis report, your own NeuroFlex scan. Because all of the Brain Excellence Centres around Australia offer baseline testing, rehab protocols, and performance protocols. We're here to assess, help you recover, and get more out of life post-concussion. So if you're not local to the Gold Coast, then hit up this website, brainexcellence.io, and you'll find a Brain Excellence Centre near you. If you are local to the Gold Coast, then here's what we can do to help you. We're based on the Gold Coast. We're here in Southport. So our initial consultation normally can be up to $165 to go and just see a chiropractor normally. We add in the NeuroFlex testing, and that alone is $65 normally. So simply because you listen to this webinar tonight, you can get that special rate for a combined assessment and NeuroFlex baseline test. Full explanation of what's going on with your results. We do all of that for just $97. We'll refer you out for x-rays or a standing EOS scan if needed, if that's clinically relevant for you. And if you have a Medicare card, then there should be no additional cost for that as well. We take you through those results too, on screen, for you to see for yourself. We don't just tell you what's going on, we show you what's going on. Because to not know is to guess. We don't like to guess, we like to test. Once you do this, you will know what level of wellness you have right now and what a step-by-step plan might look like for you that can help you improve. So we've got a couple of QR codes here. The one on the left will take you straight to our website where you can book in that consultation online, or you can contact us if you want to ask any more questions. All of our details are on there. The one on the right here is where you can go and find us on Facebook or Meta, and we're available on there. You can send us a message. You can interact with us on our Facebook page. We would love to be able to talk with you about this, and if you have any questions about your concussion or a concussion that might affect someone else in your family, that's what we're here to do. The references, by the way, for tonight's webinar are all here. So if you're keen to look at the science like we do, you can check out the references that we have. You can pause the recording, or if you want the list sent to you, just let us know, and then we can send you the article so that you can read all the science in depth for yourself. But jump on our website, jump on our Facebook page, and if you have any questions, do we have anything in the... Okay, so in the chat, we've got a question about the NeuroFlex scan. No, the NeuroFlex scan itself doesn't hurt. There's nothing that's going to hurt. We use a pair of VR goggles to do the test. You're sitting in the chair in the seat behind me here, and we run the test. It takes about 10 to 15 minutes, and it's just following commands that we tell you and on screen. So for example, you follow a dot in a figure 8 pattern and you'll track it with your eyes, and then you'll keep your head still and you'll track it using just your eyes and not moving your head. We track all of these different things. It tracks 61 different metrics across those 8 different tests, and it does that in just 8 to 10 minutes most times. If you've never had VR goggles on before, it can be quite the experience for you. So obviously we make sure that you're used to what it is that we need you to do and that you're comfortable with the testing, but no, it doesn't hurt. You can wear your normal clothes when you come in. You have somebody else sitting here in the room with you to keep you company. We make it super easy. Rehabs like that as well. Some of the things that we can do involve the NeuroFlex, and you can do that here. Other things are guided exercises that we can give you to do at home using pretty simple equipment, so you can improve your results post-concussion yourself in the comfort of your own home. And yes, so other question, that offer is available to someone who's not yet watched this webinar. If they know they've had a concussion, or you know that they've had a concussion, then the offer is available for them as well. If there's any other questions, I'll answer them from email or from our Facebook page, or you're welcome to come in and have a chat with me in person. It's been great sharing the concussion workshop with you this evening. I hope you got some value out of it, and we'll see you on the next one.